Well, good evening, everybody. I hope everybody's having a great day. Thank you for showing up this evening. I really appreciate it. And hopefully, we can all learn a little bit something about some kidney stones and why they get worse in the summer and how we can treat them. And there's some newer ways that we can treat kidney stones. So, those of you who don't know me, Brian Seifman, one of the partners here at the University of Michigan. I trained at the University of Michigan, but here at the Michigan Institute of Urology, I did both my residency and my fellowship at the University of Michigan. My fellowship was actually in what's called endourology, which is at the time was laparoscopy, and now we do mainly robotic surgery, but also having to do with kidney stones. So happy to talk to you about that tonight. So first of all, what's a kidney stone? Well, the kidneys, for those of you who don't know, are two bean-shaped organs. They filter waste from your blood and extra water to basically make urine. So stones form when composites of minerals that are typically excreted from the kidney crystallize and bind together. They can either deposit and stay in the kidney, or they can pass into the ureter. The ureter is the tube that goes from the kidney to the bladder. As stones pass, if they're large enough, and they can cause obstruction, when your kidney gets obstructed, they cause significant pain, potentially getting an infection behind the stones as well. Of note, people can get bladder stones, but that's a totally different process typically. Sometimes if men have an enlarged prostate, they'll drop a stone into their bladder. It may grow because they can't pass it because the prostate's enlarged. But you can also form stones directly in your bladder from men from an enlarged prostate, which is different than what we're really talking about tonight. And of note, about 1 in 10 people will develop kidney stones at some point in their life. Also, by the way, stones are more common in men, but the rate is increasing in women, so it affects pretty much everybody. So again, the size of the kidney stone can vary. It can become either just a grain of sand and pass very easily, or it can actually fill the entire kidney, which would be called a staghorn calculus. And so this is just kind of gives you an idea of where the kidney is, and this would be a stone that would be obstructing. This part is the meat of the kidney on the outside, and then we have the collecting system where the urine drains down. So stones are made up of various types of crystals, basically. Calcium oxalate are the most common type. It's created when calcium combines with the oxalate in the urine. So there's different reasons why these form. Most commonly, it's just because not drinking enough water. And particularly over the summer when it's hot, people are sweating, you get dehydrated, you're much more likely to form calcium oxalate stones. Calcium phosphate stones are also very common. A little bit different reason why they form, but hydration is still the biggest risk factor with those. Uric acid stones are the second most common, the third most common type of stone. High purine intake, which is from organ meats and shrimp, fish, shellfish, can lead to higher purines, which are composed of monosodium urate, which can then bind together, crystallize, and form uric acid stones. Struvite stones are less common. Struvite stones are associated with infections, and the bacteria can actually live in those stones. And cystine stones are very rare. They tend to run in families. Those are very difficult to treat. So who gets kidney stones? So you're more likely to get a stone if you have a family history, though not necessarily sure why. Certainly the cystine stones are more associated with families, but even calcium oxalate stones can be more common in families. White people over African Americans, if you're not drinking enough fluids, high meat diets, foods high in sodium or sugars, particularly high in sodium, can also result in an increased risk of stones. In part leads to dehydration, and also the sodium chloride channels in your kidneys will cause you to form more stones because it'll end up putting more calcium into your urine. Vitamin C supplements, if you're taking excessive amounts, I think a general multivitamin that has vitamin C in it is okay. People like to take Emergency. It's probably okay for a short course, but if you're taking it on a daily basis to try and prevent infections, I think it's probably not wise from a kidney stone perspective. People who've had stomach or intestine surgery, including gastric bypass, Crohn's disease patients can also have an increased risk of stones, in part because they're absorbing more oxalates. If you've had gastric bypass, sometimes you just can't absorb enough water, and that can make it more likely to form stones. Taking some diuretics, taking too much antacids, there's some anti-seizure and anti-migraine medications that can also cause increased risk of stones. And then also people who have high blood pressure, diabetes, and or obesity can also be at increased risk. So as I mentioned earlier, men are a little bit more likely to get stones than women, but probably about 20 years ago, that 9% was lower, but it's getting worse as for women, unfortunately, for them. So what are the basic symptoms? Well, if a stone is passing, and when it gets stuck, that's when it usually causes significant pain. So fever can occur from either the obstruction, but we always get worried if you have a fever, then you have an infection behind the stone, which can actually be an emergency. Nausea and vomiting, when your kidney gets obstructed, because the nerves that go to your stomach are also connected to your kidney, basically a lot of people can have nausea or even vomiting when they have their kidneys inflamed or obstructed. You can have mild to extreme pain. So everybody's a little bit different in terms of how much pain that they have. It depends in part on how long has the stone been there. If it's been there for a long time, then usually pain is much more likely to be more chronic and more mild in nature. When it's acute or it happens rapidly, you get that sharp pain, it's obstructed, your kidney's trying to push the stone out, it can come in waves, it can be pretty severe at that point. When stones are passing, they can cause some irritation to the kidney or to the ureter or the lining, and so that can cause some blood in the urine. Usually people are still able to urinate unless they have a solitary kidney or if stones are blocking both sides. Sometimes you can get a lot of frequency and urgency of having to urinate. When stones get down low near their bladder, in the lower part of that ureter tube, it gets close to the bladder, and so it can give a lot of irritation to the bladder, making people think that they have to go to the bathroom, even though there's not much there in terms of urine. That stone's just irritating the bladder, which is giving you that sensation of having to go. Same with the burning with urination, and I already explained the frequency of urination. So small stones can cause no symptoms. However, it only takes about a 1 millimeter size stone to actually obstruct your kidney. So stone size doesn't always explain how much pain you're going to be having. So one other thing about the pain, it usually starts in the back or in your flank behind, kind of on the side behind your ribs. And then as the stone gets down lower as it's passing, the pain will usually come around to the front of your stomach and then go down towards your groin region. Sometimes, men can feel pain in their testicles as the stone gets down low near the bladder, or women can feel it vaginally as well. So best way to reduce the risk is to drink about 2 to 3 quarts of liquid a day. Water is always best. And the reason why the water is there is just producing dilution. So the solution to the pollution is dilution. So if you have a lot of calcium crystals or calcium oxalate crystals, uric acid crystals, the more you can dilute it out with water, the more it's likely to not crystallize or grow and pass through. The reason why lemonade is important is because lemonade has, if it's made from real lemon juice, it has a lot of citrate in it. And citrate can bind to calcium to keep it soluble in the urine. So rather than binding to oxalate, the calcium binds to the citrate, which is more soluble and then can pass through. Grapefruit juice and soda, particularly sodas, they're not necessarily hydrating. Most of them have a lot of sugar in them. There's also a lot of oxalates in the dark colas. So if you do want a soda and you have a history of stones, I would typically recommend a clear soda. For example, Squirt or Sprite, because they actually have extra citrate in it. And again, kidney stones can be more prevalent due to high heat, humidity, and just dehydration. So reducing your risk, some food choices. So in general, I'm more likely to tell people low salt diet, low animal meat intake. Now, some of these other things can be also important, but part of it depends on what kind of stones that you have. And furthermore, if you have a recurrent stones, I'm a big believer in doing a 24-hour urine collection. What the 24-hour urine collection does is it looks at abnormalities in your urine as far as why you can form stones. Do you have high oxalates in your urine? Do you have high calcium in your urine, uric acid, etc.? There's lots of things that we check for in that. So if you do have a lot of oxalates in your urine, then I would tell you you need to eliminate the high oxalate foods. That would be spinach, berries, chocolate, nuts, beets. Dietary calcium, you want to make sure you're eating enough of it, in part because the calcium will bind to the oxalate in your stomach as well. So some people, again, I wouldn't say for everybody, but for example, somebody who has Crohn's people can have increased oxalate that gets absorbed in their small intestine. And so if you take calcium with food, then that way it will actually bind to the oxalate in your stomach, and then it prevents its absorption that way. And so, unless you're prescribed extra calcium supplements, then I think it's okay. And I know some of you are writing questions. I will get to your questions. I'll probably just do them towards the end, but go ahead and send them in, and I'll try and get to as many of them as I can. So in terms of food choices, eating a moderate amount of protein. So high protein diets, particularly from animal meat intake, can increase your risk of excreting more calcium, which can cause more stones. Furthermore, with uric acid stones, again, the high meat intake, the shellfish intake can also increase your risk of uric acid stones. Avoid the high salt intake, which I mentioned earlier. And then also we talked about the high doses of vitamin C supplements, because if you're taking excessive amounts of vitamin C, it can actually produce more oxalate. So how are kidney stones treated? A lot of it depends on kind of like real estate, size and location. Okay, so depending on the size of the stone, small stones can pass on their own. It can take up to a few weeks to pass, and stones that don't pass on their own can either be treated with medication or other procedures, again, depending on what type of stone it is. A good general rule is a stone that's 5 millimeters has about a 50% chance of passing. So if we're going to do a trial of stone passage, that means we're going to try and see if you can pass the stone on your own. A lot of times we'll use alpha blockers, which be like Flomax or tamsulosin. Now, a lot of men know about that medication because it's also used for the prostate. But there's some data that shows that it helps to relax the lower part of the ureter and can help people to pass stones. So that would be the medication to help open up the ureter. Painkillers, whether it's Tylenol, Motrin, sometimes narcotics or Toradol, or other medicines that can also help depending on how much pain you're having. And then uric acid stones, the good thing about uric acid stones is that they can be dissolved potentially. So as long as there's no calcium component in it, then the uric acid stones can be dissolved by using either water as a dilution, or we can give you some citrate medication that will help to raise the pH of the urine, and then that keeps the uric acid soluble. So let's say that doesn't work. You're still having a lot of pain, and we need to get your stone out. So one way to treat you is with what's called ureteroscopy. Ureteroscopy is basically where we're going to take a camera that can actually go in through where you urinate into your bladder, go up the ureter with the camera, and then basically break apart and remove the stone. So it doesn't take very long to do generally. again, depending on the size of the stone. But I would probably say most stones within a half hour, 45 minutes can be treated. If it's a small stone, we can just use a basket, and that's kind of what the picture is showing there. Larger stones may need to be broken apart. To break it apart, usually we'll use a laser to do that. It's kind of like playing Galaga or some video game where basically you're using a laser shooting at the stone, and it's basically just either breaking apart into small pieces that you can then pull out or turning it into dust that is then easily passed out. And oftentimes, depending on where the stone is, again, size and location, what does your ureter look like? Sometimes we'll leave a stent, which is a temporary tube that goes from the kidney down to the bladder, just to help make sure the ureter stays open and the kidney drains okay. So another type of treatment is to do shockwave lithotripsy. So this is completely non-invasive. So the E stands for extracorporeal, which means outside the body. And basically you use an ultrasound or an x-ray to find out where the stone is located. Once you can identify where the stone's located, you send sound waves through the body to try and break the stone that way. So it travels through the skin, so there's no incision, there's nothing invasive. You still need anesthesia for it. In part, the shock waves can be painful in and of themselves. And also, we can't have you move, because if you move, then this shock wave is not in the right place anymore. So when you use the shock wave, you're trying to break up the stone into small enough pieces that things can just flush out and then pass through on their own. Hopefully, the goal is to break it up small enough that everything flushes through fairly easily. So another type of treatment is for very large stones, and we do what's called percutaneous nephrolithotomy. What that basically means is that we go through your back. So there's a small opening in your back here, and through there we can actually put what's called an access sheath. As you can see here, it goes all the way into the kidney, and then we have a different type of scope that can go through that sheath and get into the collecting system up here. It does require general anesthesia. Most people end up staying in the hospital overnight, but through this larger scope, we can actually break apart the stone, we can pull out pieces or remove the stones however we need to at that point. All right, so we have one video here to show. All right, so this, I believe, is going to be the last one, the percutaneous stone removal. So in order to get access to the kidney, at some point, we need to actually visualize the collecting system. So basically what this is showing is that there's a catheter, the tube that's put in the bladder, and then you can put this other more smaller tube up towards the kidney. And what it's doing is you can inject either air or contrast. And then what that does is it outlines the collecting system. So now we're using X-ray here to basically show where are the, what we call the calyces, or where we want to get access into the kidney. So first is just a needle puncture with a wire that then goes all the way down to the bladder. So you get what's called, we call through and through access. We basically have our access, then we can put this sheath in that I was talking about before. And then the scope goes in, it can grab smaller stones, but this sheath is roughly about 1 centimeter in size. And so through there, you can take out obviously larger stones. And then if the stone is even bigger, we can basically, it was giving a really quick laser to fragment the stone very quickly, get all the pieces out, and then they injected some contrast just to make sure that everything looked okay at the very end. And then I believe that they're just putting a stent in here at the after the procedure, so that tube that goes from the kidney all the way down to the bladder. And then usually we'll leave what's called the nephrostomy tube overnight, just allows the kidney to heal and making sure everything drains okay. Okay, so now there is a new device that I'm going to talk about that's made by a company called Calixo. And the reason why they invented this device is because, the scope itself cannot remove stone fragments. And so the laser, though it can break apart the stone, again, cannot remove the fragments in and of itself. And one way of treating the stones is to try and dust it. Well, you know what? The dust doesn't always flush out. You're trying to break it up into small particles. There's lots of different types of baskets you can see here of different shapes and sizes and configurations. Some of these baskets, it's hard to remove multiple stones at once because if you get too much, then it gets stuck trying to come out. And if you're trying to get into certain areas of the kidney, like in the lower pole of the kidney, it can be one of the more difficult places to access. So with this Calixo new technology, it's something called CBAC, which basically is a procedure that allows a ureteroscope to basically fragment, irrigate, so fragment the stone, irrigate out the kidney as it's going, and also remove the stones all at the same time. So the goal of this is to ensure that no fragments get left behind. Obviously, you leave fragments left behind, they can potentially pass again, which can lead to, pain or stone regrowth or more emergency department visits. And the duration is really typically the same as a regular ureteroscopic case. So certainly, lasts about 45 minutes or so. One thing that this does allow you to do is actually work on larger stones than you normally would potentially go through the back. So the reason why we go through the back for big stones is because you can only break up stones for so long. You can't really see because you get too much dust. This allows you to, with the irrigation, and it's basically vacuuming out the stones as you're treating it, which allows you to basically see it much better. So this is just a brief picture of it, but it's an all-in-one system that does the ureteroscopy. So it's got the camera. There's a laser that will actually go through the system. There's an irrigation port as well as an aspiration, and then it collects a stone. So just to give you a sense, this is the hand piece. This is an aspiration, so you basically squeeze on it and it sucks out the stones. This is the handle that allows you to steer the scope if you want to go up or down or wherever you need to get to the stones. This little opening here is where the laser fiber goes into. This is the collection device. So when the stones are being aspirated or sucked out, this is where they'll collect, so you can send stones for analysis. And then down here there's the inflow and the outflow of the fluid going in and also the aspiration coming out. So I think I just basically explained everything, but here's it in a different view. Your irrigation or your aspiration, your stone collector. This is the whole scope that goes all the way up in the kidney. You can see it as a 250-degree tip deflection. So this allows you to get into basically almost all areas of the kidney. And it's a digital camera on the end of it. So you actually get very good visualization with it. There's different size laser fibers that can go into it. 200 and 300 micron fibers are what we most commonly use. So it's not using something that we wouldn't normally be using. And again, so as you're using a laser and it's dusting the stone, this system is actually sucking out the dust fragments as you go, which allows for, much more effective and efficient stone clearance. It's maintenance free because it's disposable. So each time you need one, you just get a new scope. So, and I think we have another video here that basically just, nope, almost. So we'll have another video that will show basically how this works. But so what it's doing is it's flushing out fluid. So it's a continuous flow. So as you're using the laser to break up the stone here, if you don't have that aspiration, the fluid that's going, these tiny little pieces can obstruct your view. So it becomes almost like trying to work through a snow globe. So what this does is it actually irrigates it out, and it's also removing those fragments as you go. So this is kind of what we call passive aspiration, which is what we normally do. And then here's the active, so where you don't get that dust and you can see it a whole lot better. All right, so here's our next video to basically just give an idea of this. Pretty cool music behind it. So again, the all-in-one system here. And it's pretty close to the digital scope, and digital scopes give you much better visualization than some of the older scopes. So again, just starting from through the bladder, going up the ureter. So the first step is just to put a wire, and then there's what we'll call an access sheet that goes over that wire. The scope actually, feedback scope goes over or through the sheet to get into the kidney. And the idea is that as you're lasering away and breaking it apart, it's breaking it and it's sucking out those little pieces while continuing to give you good visualization. And I think that in the top right, it was showing that it's also collecting the stones too. So I know you're thinking, well, gee, there's all these little stones left behind. So you can take the laser fiber out, and then it makes a larger channel. So then you can actually remove larger stones, pieces that are still left behind. You can remove up to stone fragments that are 1.7 millimeters for sure. 2 millimeters, most of those can be removed as well. So here you're just basically sucking out any kind of remaining stone through there. So, and I will tell you that more often than not with the system, if you were not stented beforehand, you'll probably need a stent afterward, just because it is a little bit of a larger size scope to get up into the kidney. So, okay, so that's my basically discussion. So let me get through some questions for you here. All right, so can you take a citrate supplement to help reduce stones? Absolutely. So there are prescriptions called Urocit, Urocit K, which is a potassium citrate. You can also still find it over the counter. Amazon sells it in, basically a powder form in a big bag. So you just add it to your whatever drink that you want, and then that can help to reduce some stone formation. How much do you need? Kind of depends on if you have uric acid stones, you probably need a higher dose. If you have calcium-based stones, kind of depends. If your 24-hour urine collection shows that your citrate level is normal, probably not going to help all that much, but it certainly won't hurt. So what about substitute sweeteners like stevia? I have to be honest, I don't know for sure. My guess would be that most sweeteners are probably okay in terms of stone formation, but frankly, I would have to look it up because I'm not positive. So, have I heard of Chanca purda? No. If I can't pronounce it, I probably haven't heard of it. So I apologize. I'm not going to be able to tell you much about that. Any vitamins I could take to prevent oxalate stones? There's really no vitamins to take to prevent oxalate stones. So the question is, with oxalate stones, is it an absorption issue? Which it usually is. So there's a couple different ways to prevent oxalate stones. So one would be to limit the oxalate foods in your diet. Chocolate, spinach, nuts, strawberries, rhubarb, sweet potatoes, beets are some of the common ones. Now, if you can't do it with diet, then sometimes taking calcium or Tums with your food can actually help as well. Because again, what it'll do is the calcium will bind to the oxalate in your intestines and prevent it from being absorbed. I have a soreness in my lower back every morning that goes away during the day. Is it a stone? I think that's very unlikely. And the reason why is because your stone doesn't know what time of day it is. And I would say, without knowing anything else about you, I would probably say that that's more back or muscular related. So osteoarthritis, kind of the hallmark is when you wake up in the morning, you're stiff. And then as you move around, your joints get lubricated. And if your pain goes away, it's probably more related to that. I think it's probably unlikely to be a stone. If it's a stone, it's usually severe pain that comes on more sharply and doesn't necessarily go away just as you move around during the day. I heard if you eat cheese every day, that will help get rid of oxalates in the kidneys. You might, but you also may gain a lot of weight because obviously there's a lot of fat in cheese. So what the cheese is doing is it basically is binding to the oxalates in your diet. So again, if that's the reason why you're forming stones, it can help because there's high amount of calcium in cheese. So that's where that's coming from. So I wouldn't tell you that it's not going to get rid of stones that you have, but it can decrease your oxalate absorption to decrease your risk of new stone formation, or sometimes stones getting bigger. Okay, can you take turmeric, basically, curcumin C3 complex low dose oxalate if you're prone to kidney stones? Again, it's probably okay. So if you've had them, then you got to try and figure out why you had them. So especially if you've had one stone, I wouldn't be too worried. If you've had multiple stones, then I think you need a 24-hour urine collection because maybe your oxalate levels are okay. So a lot of women are taking vitamin D and calcium supplements. How do you know if you've taken too much? In part, you're checking your blood work with your endocrinologist or your primary care doctor. But then the question is, are you dumping too much calcium in the urine in those situations? I would say the same thing for oxalates. So if you're taking a low dose oxalate, you do a 24-hour urine collection while you're taking the supplement, and your oxalate levels are okay, you're probably okay to still take it because that's not your risk factor for forming stones. Had intact 3 years ago. I did 24-hour test 2 years ago. High levels of uric acid, prescribed allopurinol. So, and made you drowsy. My opinion of allopurinol and is there alternative? So here's the thing, when it comes to uric acid stones, you could potentially have high uric acid levels in your urine, but not have high serum uric acid levels. So if you're, again, 24-hour urine collection, if your uric acid level is high in the urine, but your blood serum uric acid is normal, I would actually treat you with citrate. So like potassium citrate or Urosec K. What that does with uric acid stones, they tend to crystallize in a lower pH of your urine. The potassium citrate raises the pH of your urine, and what that does is it keeps uric crystals soluble in the urine. So by higher pH and by diluting your urine with fluid, that would be my best treatment for you. So, and I only treat with allopurinol if your serum uric acid levels are high. So if your blood is okay and it's just in your urine, I would treat you with citrate and fluids. I take Pepcid for reflux. I've had 2 kidney stones. Is this medication risky as far as forming stones? Pepcid, I wouldn't be too concerned about forming stones. I think that's pretty low risk from that perspective. If you have had kidney stones, are you more apt to have them in the future? Yes. Once you've had one stone, you have a 50% chance of forming another stone in 10 years. If you drink up to 2 to 2.5 liters of water a day, yes, that's a lot of water, but if you do that, then it can decrease your stone formation rate, cut that 50% down to 25%. What's my experience with an opinion of the CVAC system? So I'm not paid by Calyxo or CVAC, so I will certainly be honest about it. I think that it's a great first step at it. They do have some variations that they're coming out with that I'm aware of. The handle and the ergonomics are not great. So that's one issue with it. It's kind of a heavy scope. For the right size stone, I actually think it's really good. So for small stones, I don't think it's necessary. If you have a 5 millimeter stone and it's in the ureter, I don't think you need CVAC. If you have a 12 millimeter stone up in the kidney, I think CVAC's great because it really gives you a better chance of being stone free. So I think that they're having some, I'll say more minor changes that are coming technologically. But I think that the concept is very good. And again, I think for the right size stone, I think it's a very good procedure. With the CVAC, you do need a general anesthetic. Um, That'll be the same for really any type of ureteroscopy. We don't want you moving. Now, it doesn't mean you have to be intubated, but at least putting it's called the laryngeal mask airway. So it's just a tube that sits in the back of your throat that doesn't have to go all the way down into your trachea, I think is necessary for that procedure. So yes, you do need general anesthesia. I have high oxalates and can't stop eating berries. Can I take calcium supplement to offset the berry intake? Yeah, I mean, I would certainly do that because, again, the calcium will bind to the oxalates. So if you're have a berry addiction, then certainly taking some Tums when you have your berries, then I think that's probably reasonable to at least try it and see if it makes a difference. Best way to remove a stone from a bladder depends on size of the stone. So if it's small, you may be able to still grab it and pull it out. Small being, I don't know, 8 millimeters or so. For a bladder stone, that's small. If it's a big stone, I would use a laser and break it apart that way. So wouldn't use a CVAC system because you have different scopes and different reasons for it. But basically, I use a laser, break apart the stone, turn it to dust. You can flush it out much more easily in the bladder. Now, if it's a huge stone, or if you have, some people can actually get almost like a gravel pit of stones. Sometimes you actually have to open up the bladder and just basically scoop it out that way. So you do that through, a small, 2-3 inch incision and take it out that way. I had my large intestine removed due to colitis and cannot drink fluids like I did prior. Any suggestions? That's tough or difficult situation because, again, hydration is probably the most important thing you can do. In your situation, you still also may be having a lot of, my guess would be calcium oxalate stones due to poor absorption. So I would potentially consider doing, Tums as well, because again, it'll bind to the oxalates. If that isn't helpful, sometimes we'll try citrate anyway, because sometimes increasing the citrate amount in your urine may help to decrease your calcium oxalate stone formation by having the calcium bind to the citrate. And I would also probably do a 24-hour urine collection, because I think that'll tell us what other issues you have besides just lack of fluid. But no, I know that can be challenging. How do you know what kind of stones you have? When you take the stones out, we can send them for analysis. Or if you pass a stone, we can send it for analysis, and then that'll tell us exactly what it's made of. If you have calcium formed stones 1 year and have a kidney stone recurrence years later, is it safe to say you have calcium stones, or they could be oxalate or another form? So to say calcium, there could be calcium oxalate, calcium phosphate. It wouldn't just be, pure calcium. Usually people will form the same type of stone, not always. One way to differentiate calcium oxalate from uric acid, for example, is on a plain x-ray. So on a plain x-ray, uric acid stones will not be visible, whereas calcium oxalate stones or calcium phosphate stones will be. But I would say more often than not, people do have the same type of stone that tends to recur. Can regular use of laxative cause stones to form? Yes, because you're, from a dehydration standpoint, certainly. So if you have constipation, that's in part treated with water intake. If you're having constipation and you require the laxatives, you're not having diarrhea, and you're not overusing it, then I think that it's still okay to use laxatives in general, as long as they're not being abused and they're being used appropriately. I think that they're okay. Does physical activity help about decreasing stones? I would say, it's not necessarily going to help decrease stones. It's great for you. So walking is good. It's good for your bones. It's good for your heart, etc. It's not going to do much for stones unless you're walking when it's 90 degrees out, 85% humidity, and you're not hydrating. So I just make sure that you're hydrating yourself when you're out there walking. Are there preventive measures still effective against a genetic role in stone formation? So it depends on what you mean by that. So because if you have cystine stones and there are medications that can help with that, again, those are pretty rare, but there are medications that are available. And otherwise, if it's just a family history and everybody's got calcium oxalate stones, again, it's going to be the same type of measures that we've been talking about in that situation. There's not something specific or a genetic mutation that we can alter or to get it to change that way. Is kefir good to prevent calcium oxalate stones? I'm not familiar, so I can't tell you for sure. Can you exercise and play golf with a kidney stent? Because I have one inserted. So, well, I'm sorry you have a stent in you. You can. So I tell people that when you have a stent in place, it's not likely to go anywhere. It should stay in place. But the more active you are, the more it's probably going to be more annoying. The more it'll probably give you some more blood in your urine. Because as that stent moves around, it just can irritate the lining of your bladder or your kidney, which can cause more blood in the urine. So I would do it based on your activity. If you feel okay, then I think it's okay to do whatever kind of activity that you want. Is there a product or medication to slowly dissolve existing stones? Really, only uric acid stones can be dissolved, and that's with citrate and hydration. Calcium-based stones cannot be dissolved. I get a stone at least once a year. Stone stopper is recommended. Is it effective? I think that I'm not positive, but I think stone stopper and kidney cop, I think are basically composed. I think they have basically vitamin B6, magnesium, and some citrate in it. So just confirm that that's really what's in there. Those things can all help to decrease stone formation. Because it's a over-the-counter supplement, the doses that you get in that is not typically as high as you would get from a prescription if you need the potassium citrate, if you need a higher dose. So it's a lower dose of citrate, and I'm pretty sure that's exactly what's in it. I have an enlarged kidney. What are my risks? I'm not sure exactly what that means. So it just because you have a bigger kidney in and of itself, that's just the meat of the kidney. That's not a problem. If you've what's called hydronephrosis or dilation to your kidney, that can, or what's called the UPJ obstruction, that can increase your risk if you're having stasis, of the urine in your collecting system. So I'm not exactly sure what the question is. So, but potentially. Do issues with IBS and diverticulitis contribute to stone formation? IBS and diverticulitis, no, but Crohn's and ulcerative colitis, I would say yes. Again, because of the absorption issues. With IBS, if you have IBS from causing diarrhea, then it's just a hydration issue. Metamucil daily, can it cause kidney stones? No, you're okay to take your Metamucil. I don't have a problem with that. A cranberry supplement. Cranberry supplement really has nothing to do with stones. It can decrease your risk of getting bladder infections. There's actually some decent data that shows that can decrease infection risk, but from a stone standpoint, probably not going to do much for you. How many tums per day would be good to prevent calcium oxalate stones? Again, I'm just going to caution because I don't know that you do have high oxalate levels in your urine, but usually I give 2 tablets with meals 3 times a day. And then I usually will repeat your urine collection to make sure that it's actually working appropriately. If you've had kidney stones in the past, shouldn't you have an ultrasound before each semi-annual appointment with your urologist? Well, I mean, I guess it depends on, how long has it been since you've had stones? How big were they? How were they treated? Do you know you're stone free? If you're being seen every 6 months for something else. I don't know that you necessarily have to have it all the time. So, I mean, I guess I don't want to say that you need to have an ultrasound every 6 months. Maybe you do, maybe you don't. That's difficult to answer for each individual. Can a CT scan tell what kind of stones? A little bit, or it can suggest. So the calcium oxalate monohydrate stones are very dense and very hard. And so if you measure what's called the Hounsfield units, which is how kind of bright the stone is on the CT scan, that can give you an idea of really of what kind of stone it is. So the higher the number, the more likely it is to be calcium oxalate. Can hyperparathyroidism cause kidney stones and osteoporosis? So hyperparathyroidism, absolutely, because what it's doing is it's basically causing your bones to break down. It causes calcium levels to be high in your blood, which then gets dumped in the urine, which causes stones. So the hyperparathyroidism definitely has to be treated to decrease the risk of getting stone formation. When we learned about hyperparathyroidism in medical school, moans, groans, bones, and stones. So those are the kind of the things to remember about hyperparathyroidism, but stones is definitely one of them. And osteoporosis, again, I think it's okay to take the calcium and vitamin D supplements, but I think that it's probably worthwhile if you have recurrent stones to make sure that you're not over supplementing. If you're taking a vitamin C supplement, but have had 2 instances of kidney stones, you recommend stopping the vitamin C? Yes. But I would also, again, I would do the 24-hour urine collection, because that will tell us, is it an oxalate issue? So, and again, if you're taking supplement that's part of a multivitamin, it's probably okay. But I wouldn't generally recommend taking an additional vitamin C supplement. Is it safe to drink electrolytes if you've had a prior kidney stone? So that's a little bit difficult to answer. A lot of the electrolytes, like Gatorade and Propel and things along those lines, check the salt content, because if the salt content is high, then that's where I'd be more concerned. So it's trying to, a lot of these drinks are, you're drinking plenty of fluids, you're working out, maybe you've lost a lot of fluids from sweating, so you want to replace some of it. But I think that you got to be careful with taking too much salt in if you have a history of stones. I would in general tell you, water is best. So just be aware of your salt intake in some of those fluids. In addition to drinking more water, what type of foods will help increase the daily hydration? Fruits and vegetables. So, watermelon, cantaloupe, and things like that. But again, cantaloupe high in vitamin C, watermelon be fine. Does eating too much fruit or vegetables cause stones, and what fruits or vegetables should you avoid? So fruits and vegetables, again, so some of the fruits like cantaloupe have high vitamin C levels. Same with oranges, obviously. In terms of vegetables, it's the oxalate issue. So spinach, beets, sweet potatoes, some of those have high oxalate levels. You can probably find it online too, a whole list of, other things. I think fava beans also. My cardiologist wants me to take a diuretic. Is this contrary to drinking a lot of water to prevent kidney stones? Well, a little bit. Again, it's a balance. So you want to make sure your blood pressure is okay. You want to make sure that if you're taking the diuretic for heart failure or for swelling the legs, you got to make sure you do that. If you overhydrate, we don't want to put you into heart failure while trying to prevent kidney stones. So sometimes it's just a balance. If you're taking levothyroxine at high doses, can it cause stones the same way hyperthyroidism does? It's hyperparathyroidism. Hyperthyroidism is okay, in terms of stone formation. So levothyroxine is okay. It's the hyperparathyroidism. Is it okay to take D3 and K2 supplement? So I'm guessing that the K2 is just potassium. So yeah, that's okay. No problem with that. D3 is okay too, again, so long as your levels are not too high. And can multiple small calcium oxalate stones fuse together and create a large stone? They can. So if you have very tiny, let's say you've had shock of lithotripsy, you break it apart, but you take a 1 centimeter stone, you get some 3 millimeter stones that are left behind. Sometimes they will coalesce if you continue to have the same risk factors. And is it safe to do a celery juice cleanse if you have a history of kidney stones? So I don't know that celery in and of itself is a problem. But I guess based on the cleanse, you're going to be instituting a lot of diarrhea, be my guess. So I would probably just make sure you're well hydrated when you're doing that. But I don't think celery in and of itself, I think, is a big issue. So I think I got through most of the questions, if not all of them. So I appreciate your time. Thank you for attending. And if you have any other questions, please feel free to see me or any of my partners. Okay, thank you and have a good night.